Hey everyone, just wanted to give an update on my PRK laser eye surgery. It's been now 3 weeks since I had the procedure, 3 weeks from yesterday, and things are really going great in terms of my eyesight and everything else that I've discussed in the past. I had my official 2 week follow up on Wednesday, which was actually a little longer than 2 weeks, but that was when my doctor could fit me in. And things were really going great. My vision is a combined 20/40. I was a little disappointed with that number. I thought my vision was a lot better, but I can tell it keeps improving pretty much every day. So I'm pretty happy with that. And to be quite honest with you, my vision is so good that if that were to stay, if my vision stays the same, I would be very, very happy because it is 1,000 times better than what it was before I had glasses and contacts. So I'm very, very, very happy with it. I believe in the past I talked a little bit about my the light sensitivity that I was having, especially like first thing in the morning when I was driving to work with the car headlights and the street lights and stuff. Earlier in the week, that got worse to where it carried over or carried throughout the day, where it just felt like everything was just very bright. I just wanted to squint all the time. So during my doctor's appointment, I discussed it with my doctor, and he put me back on the steroid drops and told me to start taking those again. And to take those until that light sensitivity goes away. So I'm doing 2 drops a day, so one in each eye, and I'm doing that twice a day, typically in the morning and then before I go to bed. And that seems to right now be helping. The light sensitivity is not really bad at all, especially when I'm wearing my sunglasses, and not bothersome. But I think what I'm going to do, because the doctor gave me no end date of when to stop taking those drops, I think what I'm going to do is do the twice a day for about a week, and then the week after just do one a day, and then the week after that try to wean myself off. So kind of just gradually bring it back down. I go back to the doctor again in 3 weeks to see how I'm doing, to see if my vision has improved. But right now at 20/40 in the state of Illinois, that's enough to legally drive without any kind of correction whatsoever. So that's just great. I'm having no problems driving, seeing street signs. I'm seeing everything pretty clear right now, even in both eyes. It's just that light sensitivity that's kind of bothering me right now. Some other things that's going on, like the doctor did warn me that my near vision would probably get worse because they corrected it for distance, which meant that things very, very close would be readable, and I would not be able to see them very clearly, and that is happening. So things like if I'm, the other day I was trying to read a magazine article, and holding it out, I couldn't read the font. It was very, very small. But some magazines have bigger font, and I was able to read that. So I'm probably going to have to pick up some reading glasses just for that really, really small stuff that I might have to read. But I rarely actually read that kind of stuff. So every day, throughout my day, I can see my computer screens just fine. I've actually lowered or increased the resolution on them now, and lowered the font size down. So they're almost back to normal. And so there's really no problems at all with me seeing the computer screens. I can do my job and everything else, but with no problems. But like I said, it's just reading those fine little, the fine print on things is rather difficult for me to do. So I'm back doing all my activities. I'm back working out, all that kind of stuff. The doctor gave me full clearance to get back to everything I normally do, with the exception of scuba diving. I still have to wait probably another week. He said give it the full 4 weeks before I can go back to scuba diving, which is no big deal. Like I said, before, it's now March in the Chicago area. there's not a whole lot of scuba diving going on, so I'm not really missing much out. But the primary delay, why for the scuba diving, was just getting water in my face, especially if it's water that's been, outside. You don't know what kind of bacteria might be in it, and you just want to kind of make sure everything is really healed up to prevent any kind of eye infections and stuff like that, or that could affect my healing of the cornea from the surgery. So, which is fine. So I'm looking forward to get back to diving again soon. But everything else has really been going great. So I think I'll do another follow-up video probably in 3 weeks after my last follow-up. That'll put me at roughly 6 weeks, almost 2 months out from the surgery. So I'll do a follow-up then and let everybody know what my vision, if it's improved at all. But right now, I'm loving it. I'm loving not having to wear glasses. I can watch TV and not have to wear my glasses. I can see pretty much everything just fine. I can stand across the room and do that test that I mentioned earlier, the last video, where I can stand across my kitchen and read the time on the microwave clearly. I'm still amazed at how much better my vision has gotten. I was just sitting there the other morning, and I looked out from across the street, and I could visibly read my neighbor's license plates on their car, and I'm standing all the way in the back of my house, and my vision is just great. I can't tell you enough, just how wonderful it is to not have that scratchiness of contacts and not have to worry about glasses and scratching my glasses and carrying them around and carrying around 2 pairs of glasses and all that kind of stuff. It really, really is awesome, and it really was a good decision for me to get this done. And if I need reading glasses for that small print, so be it. It's not going to impact my life all that much because I really don't read stuff that close. Reading my phone is fine. I really have no problems reading my iPhone. So things are really going really, really good. So as far as managing my diabetes, everything is great. For some reason, the 2 weeks after the procedure, my blood sugars ran a little high, which I kind of expected they would. By now, they're all kind of normal and everything else. So again, there really wasn't any issues there. So, but anybody who's out there who is contemplating getting PRK surgery, some of the things that I'm glad I did beforehand really helped me during, after my recovery. And that is things I didn't have to worry about. So there's a lot of small things in our lives that we have to do on a regular basis that you don't realize you need your vision for. Simple things like clipping your fingernails. If I would have had to have done that, the week after my surgery, there's no way I could have done it. So, doing all that small stuff beforehand, getting my podcasts and my audiobooks all lined up and queued up. So all I have to do is hit a button to listen to them. All that stuff. It makes it a lot more convenient and less things I have to worry about during my recovery from the surgery. So when you go into and think about things like that, when you're going into your PRK, that try to make life as easy as possible for you while you are doing your recovery. Such as some of the things to kind of think about with that. But if you're contemplating it, it's definitely worth it. Even if there is a little bit of pain that you might experience during the recovery, the pain will not last all that long. It really, for me, there was no pain, but other people have pain. But it's definitely worth it to not have to deal with glasses and contacts and have clear vision and to see clearly is truly, truly just a wonderful thing. So that's it. So I will put out another video probably in 3 or 4 weeks, kind of doing a follow-up to let you know where I'm at 2 months out, and we'll see if my vision has improved. But I do have all the forms I need to get my doctor to sign off to get the restriction removed from my driver's license. So he'll be signing off on that. That way I can get my driver's license renewed. When I renew it, I can get that restriction lifted to show that I have no need for corrections on my eyes. So that's it. I'm signing off.